I'm going to tell you what I'm doing first of all. Welcome to Ask Jane. And the reason, so this is on my social media. If you follow me, you know that a lot of times I'll say, Ask Jane, and you guys have all kinds of questions. And so I decided instead of just writing about it, that it would be fun on Thursday nights to do Ask Jane Instagram Lives. And what I'm going to do is I'll have, like, this week I've been talking all week about looking and feeling young. And I would like to say that the key to looking and feeling young is all about diet and exercise and what's in your mind. And it is, but it's more than that too. It's also about procedures that you have done, stuff like that. So what I'm going to be doing with Ask Jane on Thursday nights is I'll be here. You can ask me anything you want to ask me, or sometimes I will also ask someone who I really trust in a particular area to come on. This will always be somebody who I have used for a number of years, who I think is really great at what they do, and I've had personal experience with. That's the only way I would recommend them. And so this week, I have asked Dr. Rod Roig to join us, and so I'm going to see if I can get him hooked up now, and he will be on with me. Dr. Roig, are you there? Dr. Roig?
Hi,
There he is,
how are you?
right there. So what do you want to ask Jane?
Well, whatever you want me to do. So, yeah, look great.
Thank you. Thank you. Okay, I think we're all hooked up. So I'm going to tell you that I do want you, I've got my glasses with me so that I can actually see your questions. So if you have questions to ask Jane and ask Dr. Roig, please put your questions on the screen and I'll be glad to answer them. So anyway, Dr. Roig, I guess the first thing I wanted to do is, I've been talking all week about looking young, feeling young, all those kinds of things. I know you and I both believe diet and exercise are all important and all that. But for about the past 15 years or whatever, I've come to you religiously, and you have kept me, I think, looking really great for where I am in life. And so I wanted you, one of the things I've been asked is women and their jaw lines as they get older. It's a real issue. So the thing that we did with my jawline and neck was something called Morpheus 8. And a lot of people have asked me, you can explain a little bit about it. And a lot of people have asked me, how many times do you have to have that done? I think I've had it done 4 times, right, over the last couple of years. I'll let you take it from there.
Yeah. Well, it's great to see you. And of course, you've always looked great. So that's the key, is to take somebody that looks great like you and keep them looking great. So, and you mentioned diet and exercise and avoiding the sun and not smoking, and all those things are important. But the jawline is something that's very important. And, Morpheus 8 is one of the things that tightens the skin. It's radiofrequency skin tightening. And it's a series of treatments between 2 to 4. And you can see Jane looks awesome with that. You do it in the face and the neck, and it helps to really tighten that and also remove some fat in the deep layers. So it's skin tightening as well as some fat removal. So it works amazing for that, and especially somebody that really just is in that transition period of really maybe not ready for full face or anything like that. So it's great for that. And then there are other things too that that we do is you can inject Botox into these strong muscles here. Yeah, because sometimes, Jane, is this is a very important muscle. It's the strongest muscle in the human body. And many times when people have bruxism where they grind their teeth, it helps that. And also the other thing, a side product of that, is it actually makes people look more narrow, because this muscle can make you look square. So often I inject Botox in there, and it does 2 things. Makes you look better, but also gets rid of those TMJ symptoms. So those are the jawline basics. And then the other thing is I sometimes put filler along the jawline. I don't think we've done that, but we've done, and you can put filler along here. That'll emphasize it. And then in some patients, in younger patients, if they have really a lot of fullness here, you can take out the buccal fat. And all of that jawline nicer.
Okay, so someone has asked a question. Are you the only doctor who does Morpheus 8, or is it universal?
No, well, I'm not the only. I was one of the first ones in really in North America, along with, because I know and I've worked with the company. I've done a lot of their clinical research. No, it's now available, in a lot of dermatologists and plastic surgeons' offices. But the key is, you know, it's who's doing it. You know, my nurse practitioner does it. I do it in the operating room many times, but it's really, it's a finesse tool. It's a high tech tool, but it's always who's doing it. It's kind of like surgery. You know, you got to make sure you're having the right person doing it. So you just can't say, I bought the Morpheus and come on over, you know?
Come on over for a Morpheus party. So,
Right.
and people, another thing people have asked me, ask Jane, is people have said, does it hurt? I'm going to be very honest with you. Yes, it does hurt because it goes, but that's because it works. It goes very
Right.
deep. The good thing is when I've had it done, David, your nurse practitioner,
Yeah.
always make sure that I have a lot of numbing gel, you know, so it doesn't hurt badly, but you do feel it.
Yeah, no, you do feel it, and he puts numbing medicine on and stuff, and he does it incrementally. And of course, the deeper you go, like Jane said, you know, it does have some discomfort. And I think, you know, but then you get more of an effect, and you know, you treat it sequentially, 4 to 6 weeks apart, and then you'll get that skin tightening. And sometimes it even lasts a lot longer. So
Okay.
that's great.
Somebody has a question about cheek filler. I'm going to get to that in just a second. But first of all, I did want to say one more thing about Morpheus 8. Okay, Phil, do you see that question? Okay,
Yeah,
we'll
but
come back to that. Okay, so one more thing about Morpheus 8. The other thing I've done is I've used it now. David did the first time on my arms because a lot of women, I mean, I just got back from the gym. Doesn't matter how much you work out, your arms just don't, I don't know what happens. I'm not sure what happens. I've had it done once. I can kind of tell, you know, so far. But two things about that. How many times do you have to do it in order to really be able to tell? And the other thing that's important in terms of, I guess, where you have it done is David explained to me that because you're a doctor's office, you guys can go a little higher on the intensity of the Morpheus.
right,
And
you get
necessary maybe with the arms.
right, you can because it's a little less sensitive, and also the higher the intensity and the deeper you go, the more you can take fat out. It'll vaporize the fat and tighten the skin. Usually 2 to 4 treatments in the arms, and I think it's pretty amazing to do that without the arm lift, because the arm lift is a great procedure, but it's a long scar, so you don't want that in most cases, and certainly you don't need any of that, Jane. But the radio frequency is very helpful for that. It really is. It's probably the most high tech, best technology that's been available now in the last 5 years that works. But it's got to be something that's done sequentially and done in the right hands, because you know we alter the frequency and the depth on every patient. So it's like anything else, you have to fine tune it towards the patient. It's like, you know, doing a rhinoplasty. Not all rhinoplasties are the same either. So
Well, I can tell you, I'm thrilled. In fact, I think you saw the picture that I posted the other day.
yeah.
I was looking in the mirror and I had no makeup on, and I looked in the mirror and I thought, oh my gosh, my neck looks so much better. So I'm very, very happy with it. All right.
I was really impressed because you never see people that aren't morphed on Instagram hardly. It's amazing. That's why I almost always post videos, because it's hard to morph a video, but you know, that's a crazy thing. But I know there was one thing about how I filter fat. I mean, I filter fat in the operating room, and I filter it very carefully. It's a sterile technique where we filter it and so that it comes out, so it's micro fat, and then we inject it all around the various compartments of the face, which I described several years ago. Because fat is probably the best filler, but we only do that in the operating room. When we're not in the operating room, we usually use great fillers like hyaluronic acid fillers. But you know, fat is phenomenal for filling. I use it all the time, especially in facelifts. You know, it's
Okay. So I want to ask you, talk about just regular filler, like most women think of, or men for that matter. One of the things that you've done with me that I really like is you have taken filler and put it sort of not in my temples, but almost that high. And it has the effect of a little bit of lift.
yeah.
As opposed to putting in front, it has that effect, right?
It really does. And what it does, what Jane's talking about, is we use a deeper layer filler for the cheeks, and you put it high in the cheeks and here, and then also right here in the nasolabial fold. And it gives the illusion of lifting it, but it's really filling. And you know, you can see that on Jane. She's beautiful anyway, but this gives you the illusion of filling and lifting. And it really works great. And it works, you know, for a certain time period. But once people start getting jowls, then you have to consider a facelift. But you know, you're not quite ready for that, and that's good. And that just gives you that extra boost.
Well, I like to be transparent and I don't want anybody, I mean, we see so much on Instagram now where people are like beautiful and they look perfect and they say, well, I haven't had anything done at all. Well, I don't want women to feel like that's realistic because in general, it isn't.
Yeah.
Okay, Sculptra for the face, was that a question? Did you just
Yeah.
see that?
Sculptra is great. It's a biologic stimulator, and it's a serial treatment. You do it and you blend it. It works great. If you really have a lot of volume fat loss and you're not going to the operating room to do fat, it works great, but it's serial treatment. You have to inject it deep. You have to blend it and do it deeply. And really, it should be done by somebody that really does a lot of Sculptra. And I think that's what you need to go to somebody. You say, how often do you do Sculptra? I mean, I did the FDA trials for it a long time ago. It's really great. And then there was also another question about is Rejuvion the same as Morpheus? No, it's not. Rejuvion is plasma therapy. It's heat therapy. So that's a completely different therapy. I think the Morpheus is a little kinder and a little gentle. And so you just be
Okay.
biggest thing is do no harm. Do things and techniques and technology that are no harm, because there are a lot of things that are not as they appear. So go to trusted practitioners, board certified plastic surgeons, board certified dermatologists that do this every day, and don't go to the nearest spa that's got 30% off.
So now someone says sides of face. Do you know what that means when they say sides of face? I'm not sure about that because I have a couple more questions I want to ask you all.
No, you could probably reemphasize that.
Robin, if you want to be a little bit more specific on your question, we'll be happy to answer it.
Yeah.
Okay, I have two more questions I want to ask you. So two things are, I'm not really considering doing this. Best filler for Temple, remember that. Okay, so I'm not really considering doing this because I did the lip filler a couple of times and it kind of hurt. Didn't really like it, so I just overlined my lips at the moment. But I read the other day that, lip filler is so popular right now. And I read you've got to be careful because you can stretch the lips to the point where you have a problem. What about that?
You don't want to do the Kardashian lip treatment where you're just blowing up the lips because, you can take it out, but sometimes that can be a permanent deflation. So you got to be very careful. So I hardly ever do more than a cc of a filler. Usually I use a Juvederm or a soft filler, and you just want to do the points, the commissures, the lips, and you can combine that with a lip flip for using Botox, so you can make the lip look more gentle, just make it look natural. Most people don't want to walk around with duck lips, and also people must understand it. Sometimes when they come in and they have their upper lip being bigger than their lower lip, that's not normal. Because normal in humans is that the lower lip is fuller than the upper lip. Only in orangutans and giraffes do the upper lip is bigger than the lower lip, and not in humans. So we got to be careful. But
okay.
All the time, and so I have to melt the fat. And usually, if your lips are overdone, I have to melt the filler, and then in about 2-3 weeks, I'll put new ones in. So, and I agree, yeah, but I said it's worth the pain. If you put in the right amount of topical and use, vibration therapy like we do. I mean, last time we did it, you did awesome.
Yeah, I've got to tell you that vibration therapy that you guys use, can you explain what that is? Because that makes all the difference in the world when you're getting any of this done.
A vibratory device that actually really tricks your brain. It's called the gate theory, where basically if you're vibrating at the same time you're injecting, then you don't feel the injection. That's why sometimes it works great, and it's a vibratory therapy. And I agree with them that fat grafting, it does rejuvenate the skin. If you use fat, because there's stem cells in the fat and all those things, it does rejuvenate the skin. But that's part of facial rejuvenation. I think that's great. And somebody also had a question about laser. Now, I guess somebody saw me a few years ago and that scared her, but lasers are great, but that's significant downtime. Like if you have really deep wrinkles, really like permanent press wrinkles, then you should have a laser. But that downtime is a week or 10 days. You're basically removing that outer part of the skin. It removes about 60% of that wrinkle. But that works fantastic. But a little lighter treatment is called a chemical peel. But if you have finer wrinkles, then a chemical peel is great for that. And that's like a trichloroacetic acid peel. That's good, but the recovery from that's about 5 to 7 days. But if you really have deep wrinkles, you need to use a laser, and that works
So,
phenomenal.
all right, so I want to ask you about that because I'm curious about that because the last time I was in, David did some of the Morpheus 8 around my eyes, and I could tell. I thought, oh, that looks pretty good. But I also have noticed, if I were real close right now, you'd see, I mean, it's age. So laser is the best thing to do for if you look at your skin and you're like, this is really more wrinkle than I want.
Right. If there are deep wrinkles around especially around the lips and around the crow's feet. I mean, crow's feet are, Botox is the best for crow's feet and for elevating the brows. But that lasts, Botox, but it lasts only about, it only lasts about, 3 to 4 months. But there's a new one coming out that's probably going to last a lot longer, Revance. So there's going to be a newer type of neuromodulator. So that's going to be exciting. So stay tuned, for that. And there's all kinds of great things coming out. And there's all kinds of new radio frequency technology, the Evoke and Evolve, which I think, Jane, you've had some treatments with that for non-invasive skin tightening. And, there's all kinds of things that are finally getting to where you don't need as much surgery as you used to.
So someone says, do you use Morpheus 8 with lipo
Yeah,
suction?
I do. And I combine that with Face Tight. Like if you have significant fat and a little more skin laxity, then what I'll do is I'll use Face Tight, which is bimodal radio frequency skin tightening. I do this in the operating room. And then I'll remove the fat with liposuction. Then when I'm all done, I'll use the Morpheus as treatment 1 to tighten the skin, and then I'll have David in 6 to 8 weeks do 2 more treatments. And then that's kind of a Cadillac treatment if you really aren't quite ready for a facelift. That looks amazing to do that.
Okay. I have another question. So one of the other things that I've been looking at, and I think you and I talked about this ages ago. I don't know why it is. Like when somebody goes to take my blood, they're always like, "Oh my gosh, you have the best veins on earth." They're easy to find. Well, that's great unless they're on your hands.
Right. Exactly.
And really, seriously, and so the backs of my hands, I look at them, and I read the other day that the backs of your hands, that skin is I don't know if this is true, is as thin as the under eye skin. It's very delicate. And so the combination, it's very difficult.
The greatest thing though is, and in all of my facelift patients and any before, the best treatment for the atrophy of the skin is adding fat. Fat is beautiful there. And then if you have sun damage, then you can use what's called broad-based light. It's a great minimally invasive laser treatment. So you do 2-3 treatments. It gets rid of all those dark spots. It's amazing. I just saw one of my patients and I posted on TikTok that was a year out from her fat transplantation, and it's been remarkable. I mean, because I had done her facelift and she kept saying, "Well, I look like I'm 50, but my hands look like I'm 70."
Right.
So I had, and it's amazing what it does. So these are just little fine things, and you can use other things like fillers too. But fat does several things. It rejuvenates that thin skin because of all the stem cells that are in there. So fat is really a better filler for the hands.
So where would you get the fat from?
Well, you get it from the eye, and then you spin it. But this has to be done in the operating room. And most people have a repository of fat, but that's done in the operating room. So
Someone says, "Where can I donate some fat for?"
No, yeah, I know you use your own, but I mean that's great. And then of course Kybella is the other thing that you can use for the neck. And what Kybella is, it's really it's like bile acid. It's FDA approved, and it does melt fat. It's kind of the slow way to remove fat because it takes 2-3 treatments. It does have some discomfort, and the recovery time is quite a bit. And I personally don't use a lot of Kybella because it's equivalent to 1 liposuction treatment for 35 minutes in the operating room. So, but if you don't want to the operating room, you can use Kybella. It's kind of it's more downtime because every time you treat it, it's about 4 or 5. You have a little bullfrog neck for a while. So,
someone wants to know: is it laser or laser? Maybe they meant laser tighten skin.
Laser is ultrasound. It's really an ultrasound therapy. It does tighten the skin somewhat, not significantly. It's ultrasound therapy. We usually use that with liposuction. Vaser is a great technology, and we have that as well. We have all these high technology devices, and because I do a lot of the clinical studies for these, for all of these techniques and the new fillers that are coming out. There's a lot of great things coming out, neuromodulators for neck bands and all kinds of things. So there's a lot of great stuff.
So you said, before I let you go, you said what?
Neuromodulator.
That's something a lot of women deal with as you get older. What you call neck band. What is this?
Bands, and you can put Botox in there, and it can make them melt away for 3 to 4 months, and that's on its way to get approved for FDA use now. And then, around the lips, there's so many things you can do. You can do a little Botox here to turn up the size of the lip. You can do a little, lip flip to the lip. And then also, if you really have a big gummy smile, you can put a touch of Botox in here, and that'll soften it so you don't see your teeth as much. So
okay.
Anyway.
All right. Well, listen, I'm going to let you go. Before I let you go, is there anything brand new? You said there are tons of new things out there right now. Is there anything, like, I remember when you told me about Morpheus 8, this was about 2 or 3 years ago, because I had been talking to you and I was like, I don't want to do a lower facelift. That scares me, and you finally said, hey, there's something brand new I think you're going to like. Is there anything out there right now that you find really exciting?
Well, I think the new, longer-lasting Botox-type neuromodulators are coming out in the next several months, so stay tuned for that. There's also some other new and innovative radiofrequency skin tightening that are really almost pain-free. Stay tuned for that in the next 6 or 9 months, and we'll talk about that as they come out. And there's a lot of exciting things happening. I mean, in spite of COVID, life goes on. So,
okay. Right. Dr. Roark, thanks so much.
Yep.
I'm going to finish up with everybody. Thanks for being with me. I appreciate your time.
Great to see you. You look great as usual.
Good to see you. Good to see you. And so I wanted to tell y'all who are still with me now that, so every Thursday night, I'm going to do this. I'm going to do an Ask Jane. It'll be on different subjects. It might be like we did tonight with Dr. Roark. It may be, I don't know, it could be home decorating. It could be just Ask Jane about, I would like to do one on relationships because I know somebody who's really good with that. I'm going to do this every Thursday night. I want you to ask me your questions, whatever they are. You can ask them on here. The other thing you can do is you could DM me, hey, I've got a question for Ask Jane, or you can email me. It's jane@realjane.net. You'd think I'd know my own email, right? jane@realjane.net. That's where you could email me. Also, realjane.net is my blog, and I'd love for you to subscribe if you'd like. I post stuff there all the time, and I also send out a weekly email. So I'd love for you to subscribe if you haven't done that already. So anyway, this was kind of fun tonight. And we'll do this. Somebody says treatment for smile lines. You know what? I'll have Dr. Roark on again, and that'll be our first question we ask then. But I appreciate you being